We've heard from patients why delivering bad news honestly and empathically is so important. And we've heard about some of the research. So let's get into the skills involved in delivering that news. You may have heard of different mnemonics for delivering bad news. If you remember back to the READY model, you learned ARIA in phase 3, assess, reflect, inform, and assess. Bad news can be broken down into a double ARIA. Assess what the person thinks you're going to talk about, reflect back what they've said, inform them of the bad news, which includes a warning shot, then use silence to assess their reaction, reflect with an empathic statement, and when they've given you cues that they're ready to move on, inform them what comes next. As you heard from the research, patients find it helpful when we can go back and forth between empathy and guiding the next steps.
When you lack just a comfortable construct from which to have a conversation, I think the first thing is you lack confidence.
Practicing and learning techniques in delivering bad news are like practicing techniques on any other skill. We practice very complicated procedures. They require some mentorship, some coaching, some step-by-step processes. Now, communication being the most frequently used medical procedure deserves some bit of observed practice and feedback, much like any other skill. We use the READY model of communication. It applies in particular with bad news especially, because it assumes that at the core of a provider-patient relationship is empathy and investment towards the relationship.
It's important to remember that you're walking into the room to tell someone news that's going to change their life. And honestly, everything you do as soon as you open the door ought to be cognizant of the fact that this person's about to receive something that's very difficult. My posture, my body language, my tone of voice, my facial expression. If I walk in and I'm smiling or laughing, that's pretty bizarre if I'm about to give them life-changing news. Coming in with a plan and some awareness of that, so gathering myself is important to me.
Take a breath and plan what you're going to say. I do fall back on several of the tools that I learned from the READY program to get me ready to deliver that piece of news. And I pre-plan what I'm going to say to the family. Families don't like to hear ambiguous messages, especially when it is related to bad news. A little bit of preparation before you go into the room is helpful. I've often reflected on how powerful it is to deliver bad news. Once you deliver the message, you can't go back. So you sort of want to get it right.
When a patient first comes to me after finding out that something might be wrong, I usually start out with, tell me what you know so far.
There's no real perfect way to do this, but I find that asking a question, is there anything you can share with me about your family member that would help me? What were they told about coming here? What did the EMS provider tell them? Or do they know what happened to their family member at home? And sometimes I get a sense that it's not going to be an entire surprise.
After you give the information, you assess, asking them, how much information do you want to know? Are you the type of person who wants just the big picture, just to know what are the next steps that I need to do? Or are you the type of person that wants to know every little nitty-gritty detail?
It's a great way to get a feeling for where they're at.
There's a caveat in that first A though. There might be a problem if we ask too many questions and the patient might misconstrue that as being interrogated or us beating around the bush.
They don't want to sit and talk for a long time. Although I may need one or two pieces of important information, it's important to ultimately get to the point.
You're going to reflect back in terms of what they said to you.
The patient might say something, and with that answer, you get a prompt as to know how much information you need to deliver. You know where you are in this information map, and you've got room to provide some reflections.
These are complicated conditions, and so I acknowledge that. Gastroschisis, tetralogy of Fallot, and sometimes I can actually allay some fears because they have misconceptions about the severity of things.
When you're going to inform them, it's good to give a warning shot instead of just jumping straight into bad news.
I'm trying to prepare them so it's not just this thunderbolt out of the blue.
Research has shown that a warning shot or some priming before you deliver the news is effective. I find it personally effective because then I'm allowed to say the thing that I really need to say. So I often say things like, I have some concerning findings on your CT scan I'd like to share with you. And once you say that, their attention is now focused on the next words you're going to say.
Unfortunately, this won't be easy. This isn't what you want to hear. I wish I had better news for you, where they know it's coming. Or I see your whole family isn't here today. Should we get them on the phone? Knowing that there's something more coming, but without drawing it out too much.
And what I want them to feel is I'm in a place where people care about me and are sensitive to me. So if someone's about to drop something heavy on me, they're going to prepare me for it, and they're going to drop it as gently as they can.
First part is that short, concise warning shot, and then really not allowing any space between that and delivering the news. As soon as you mention I have some bad news or something we have to go over, patients are going to start to feel nervous. And we really need to then, without a whole lot of pause, move in, be straight to the point, short and concise.
Bad news should be delivered in one sentence. And I'll say it again, the bad news you deliver needs not more than one sentence.
You just have to be direct, factual, and realize that you're going to get every kind of reaction.
The way I pick my one sentence is to ask myself, what is the one takeaway that I absolutely want this person to leave with? Also, as you think through these skills, please make sure you are the right person to have this conversation. You can be very skilled at delivering bad news and still not be the person that the patient wants to hear from. Work with your colleagues to figure out how to make sure that the patient gets the news delivered in an honest and empathic way. Maybe even share your knowledge of the steps with them.